Okay.
Okay, the main reason why I'm doing this is because there's somebody on one of my FTM sites that is really nervous about injecting, and I remember the first time I was injecting and I was super nervous as well. So I am going to show you guys today how I was taught to inject. I know it's going to be a little bit different than how some of you guys have injected, but it has worked really well for me. I was shown by a nurse at my doctor's office, and this is what I was taught. So you have your tea, you get it out. This is the first thing you do, because it takes the longest. So while you're preparing everything, you want this to be drying. You get your tea out, and then you want to get a alcohol swab, and you're going to take it, and you are going to wipe down the top of your tea. The reason why is because you want to be able to sterilize the area, because you don't want to be pushing germs into the bottle. Okay, so you're going to set that aside and let that dry while you're doing everything else. Now it's time to pull your pants down. You gotta take your pants down, of course, and then you're gonna prepare whatever sides. I tend to generally switch sides because I don't want track marks. There's where I injected last time. As you can see, I have a little bit of a bruise left over. I inject once a week. So generally want to pick out a pretty good spot. And
Do you need help?
thinking there. Right there.
Yeah.
So once you get a spot picked out, you want to make sure, like, luckily I'm wide enough that I can kind of see my veins in my legs, so I can kind of go around them pretty easily. I can see I have a vein going right here, and it comes out, it branches this way, so I'm going to inject right here, that way I don't hit it. So you want to get your alcohol swab. I usually just use the same one. You get your alcohol swab, you're going to swab the area, and then I usually have my trash can right here, but I knew my cats were going to get into it. Then you want to chunk your swab in the trash can, and then he wants to dry the area. He wants me to dry the area with a gauze pad, and so you just dry the little area. Don't forget where you cleaned. Whatever you do, don't forget that. Then what you're gonna do, by this time, your your tea should be dry. You want to check and make sure it is, and it is. You don't ever want to blow on it to make it dry, because you're just going to put spit on it, and that's going to defeat the whole purpose, so you always let it air dry. Okay, so then you get your syringe. My tea is actually really thick. It's like Caro syrup, so I have to draw back with an 18 gauge 1.5 needle, and don't worry, this is not actually going into my leg. This is what I draw back with. You always want to do 2 needles, one to draw back with and one to actually inject. So this is the one that I would draw back with. You're going to tilt it, you're going to tilt the bottle up, and you're going to start withdrawing. And I go back to I take 1 milliliter every week. So my nurse always told me to go a little bit past it, that way you can make sure that you get enough in there, and there's enough in there. So I always try to get the bubble out to make sure that it's not counting the bubble. So as you can see, it's at a little bit over 1, and then you push back to 1, or wherever it is that your dosage is. Okay, so you're going to pull it out. You're going to hold the bottom of the syringe, because since the tea is so thick, it wants to inject it back into the bottle, so make sure you're holding the end of the syringe so it doesn't do that. And then you pull it out. You're going to pull this all the way back so that it takes the tea out of the needle. And then you're going to put the cap back on this. Twist it out of this. You're going to put it in your sharps container. You can get these at pretty much any drugstore. I got mine at Walmart. It's like $3. and you need one to be able to put all your stuff in. Okay, this one is the one that I actually use to inject with. It's a 22 gauge, 1.5 inch needle, and lucky for me, I'm not a very big guy, so I don't have to put it in all the way. As you will see, I don't actually put it in all the way, just enough to get it actually in the muscle. And mine are intramuscular, and that does make a difference. So you snap it back on, twist it back on, and you get that off. You want to make sure that it's on there securely. Push it all the way back up. Make sure you don't push the tea out of it. Just push it enough so that there's not an air bubble in it. And you can kind of start seeing the tea go up into the needle right up in here. That's usually when I stop. Okay, so you're going to find your spot again. The one that I told you not to forget where you put it. Luckily, I have somebody here with me. Okay, so what you're going to do, a lot of people that I have seen in videos, they tell you to grab your muscle and pull it up and then inject. That's not the way I was taught. I'm not saying it's wrong, but that's not the way I was taught. I was taught to, on either side of it, you pull the skin tight, and this is going to pull your muscle over so that it's tight and you can get in it well. I want to make sure I find my vein first before I do this. Okay.
Got it.
And then what you're going to do is you're going to tilt your needle over. And what I usually do is I go a little bit slower because I want to make sure that it feels right. So you can kind of feel if you're hitting a vein. I actually did that once, and you can kind of feel. So you're going to push it in. I'm good. It doesn't feel weird. It kind of burns if you hit a vein and it doesn't feel comfortable. So you're gonna kind of know. The guy that taught me told me that I know I'm just sitting here with a needle stuck in my leg. The guy that taught me told me that if you hit a vein, it's not that big of a deal. It's gonna heal by itself, but you don't really need to pull back because you're not really most likely gonna hit a vein in your thigh anyways. So anyways, you put it in. It's in a little bit, but I need to push it in more. So you're gonna push it in even more until it goes into your thigh muscle. Okay, and then you're gonna start injecting. And one thing I found is that you don't want to inject too fast because you kind of start to feel a burn. You always want to make sure your needle is upright. You don't want to bend your needle while it's in your leg. It's not very comfortable at all. And the first time I did this, I was very nervous about this. It did not feel good at all, so there's a lot of pressure right now. It didn't feel good at all, and my hands were shaking, so I tried to actually switch hands in the middle of it, and that was not a good idea. So I do not suggest doing that. It's actually not very comfortable whenever you have a needle in your leg to be trying to switch hands. So I don't suggest that.
You're dumb.
Not quite. You can actually usually hear a little bit of a squirt at the end. There's usually a little bit of an air bubble. And then what you're going to do is you're going to release the leg. That way it seals it in. And then you're going to pull it out. And you are going to hear a little bit of a tearing. That's just because whenever you pull the muscle over, you're actually pulling it over, and then you're stabbing the needle into it. And so whenever you release the muscle and you pull the needle out, it's actually coming out at an angle, so it's actually tearing the muscle a little bit, but it's not that big of a deal. It's actually just sealing the tea into it. Okay, as you can see, it's starting to bleed a little bit. It's not that big of a deal. Just take a little bit of gauze. I'm going to hold that there while I get a Band-Aid. And you want to always put a Band-Aid on it at the end because that just helps seal the hole, make sure that nothing comes out and nothing else is going to get in it while it's sealing it. I mean, you are putting a hole in your leg, so you want to make sure that nothing is going to irritate it. I have awesome friends, and they got me Spider-Man Band-Aids, and they hurt like a bitch whenever you pull them off. It's awesome, but but they look cool. Okay, so there's the site that I injected in. You just put it right over it. you know how to put a Band-Aid on. I would hope I know. But anyways, as you can see, like, this one actually came out pretty good. Now, they don't always come out pretty good in the end. Sometimes the tea comes back, sometimes it bleeds, and sometimes it does just like that and absolutely does nothing. And that's perfectly normal. You're never going to have a perfect shot. It's not going to always be consistent, and don't freak out if it starts, like, bleeding everywhere. Like, that's perfectly fine. I don't want to worry you. It's not that big of a deal. Just get some gauze, wipe it up, and clean it up real quick, and then put a Band-Aid on it, and you'll be perfectly fine. If the tea comes back, that's perfectly normal as well. Just try to seal it up really well the next time, and you'll be good. But that's it. You're good to go, and that's how you give yourself a tea shot.